Okay, everyone, welcome back to the Black Carnivore podcast. I am really excited to introduce today's guest, who is Dr. Cecily Anne Clark-Ganheart, who is an OBGYN and focuses on fertility and weight, and she uses a fasting protocol to help women who are struggling to get pregnant or go through high risk pregnancies. And she herself also lost a ton of weight on an with intermittent fasting, and has over the last year or so, I remember you were doing a bunch of experiments with different diets and with fasting. So she knows all about all the different ways that we eat and how how it works with fasting. And I'm really excited to have her here and answer all of these questions that we all have about fasting. So let's dive right in.
Thank you so much. I'm excited to be here tonight. Thank you for having me.
Absolutely. So why don't you start by telling us why fast? Why is it a good thing? Why do we do it at all?
Yeah, so fasting is, I think, an important part of every lifestyle. And there are different lengths that people can fast. When you first start fasting, or when we talk about benefits, I think it's important to kind of frame it around gut rest, meaning that there is a certain period of time that we should not eat. I mean, and that's just normal. We can't eat around the clock all the time. Typically, what happened prior to industrialization and all of that, life kind of stopped when the sun went down, right? So just naturally, if you can't see 2 feet in front of your face, you're probably not cooking a meal. You're probably winding down, also going to sleep, and some of those beneficial things. So typically, if you follow just the cycle of the year, if you're going by the sun, I mean, usually people are fasting at least 12 hours. In the winter months, it may be even more than that. And what it's doing is helping to improve insulin resistance. It's helping your gut microbiome. It's reducing inflammation. It can serve as cancer prevention. It can help, autophagy in terms of just cell recycling, rejuvenation. So there are many reasons to fast. A lot of people become interested in it for weight loss, but just gut rest is a good wellness practice to have, regardless if you're looking to lose weight or not.
Okay, great. And are there any health conditions that are improved by fasting?
I would say I mean, many, and we're continuing to learn more and more each day. So, one right off the bat, any health condition that has insulin resistance or insulin excess at its core, in theory, should see benefit with intermittent fasting. And so the reason I talk about insulin resistance or insulin excess just depends on how you prefer to reframe or rephrase it. What we're looking at is that with chronic eating and also, and I should say, chronic snacking, chronic overeating, and then also by the meal choices we make. So that's going to be things high in processed sugar, processed foods in general. That tends to stimulate insulin and causes us to have a higher rate of insulin kind of in our bodies compared to what we might if we were following a better diet or having regular exercise or lifting weights or things like that. And so what happens are there's several conditions: diabetes, hypertension, fatty liver, just to name a few, that all have insulin resistance at its core. So I think a misconception is that people assume that if in order to have insulin resistance, then that means you're overweight, but you can carry extra abdominal fat, and that not necessarily tip the scales one way or the other. But then that's when you find people who have hypertension and you can't figure out why, or they have fatty liver and you're like, oh wow, you have fatty liver, but your BMI is this. So the foods we eat and our gut microbiome play a lot into that, and every day we continue to see the link between insulin resistance and disease. So there's a ton of conditions that can be responsive to lowering processed foods, lowering processed sugar, and then also adding intermittent fasting.
So, is intermittent fasting or is any form of fasting equal to following a ketogenic diet, or do you get, do you like double your benefit by combining them?
They work synergistically, so you get more benefit by combining them. So, and that's not saying that if you don't, modify your diet to decrease your carbohydrate or decrease your sugar intake, it's not that you won't see benefit from intermittent fasting, but I kind of liken it to you're kind of just treading water, right? So you're certainly not necessarily maybe getting worse, but you're not really tapping in. It's kind of like you're doing damage control, if that makes sense. So I prefer to see people improve their nutrition. And then as you improve your nutrition, at least what I found for myself and people that I've worked with, when they're not eating as many processed foods, they're not having as many cravings. So then if they're not craving as much anymore, they aren't necessarily mindlessly snacking. Do you know what I mean? And so then they are naturally increasing the length between their meals without even thinking about it.
So, fasting while eating a junk diet seems a little bit torturous.
I think so. I mean, I can definitely tell you some people that I've worked with where they decide if they want to do, like a 48-hour fast or anything like that, or even myself when I've done an extended fast, if my nutrition hasn't been on point, or at least decent, right, leading up to the fast, no, it's not fun at all. And because half the time you're like craving things or whatnot, it's nice for these things to work synergistically. I also think it's a better relationship just with food and fasting in general. One thing that I've seen people do, and I caution against this, say someone to go on, I don't know, vacation, or you say it's your birthday, right? And everyone's like, well, it's my birthday, I'm going to eat whatever I want, yada, yada, yada. And so then they do that, and then they're immediately like, oh, I ate a bunch of stuff I shouldn't have eaten. I'm going to fast for 3 days, or I'm going to fast for 5 days. And then a month later, they're like, oh, I gouged. Do you know what I mean? And then now I'm going to, and I don't really like that pattern per se. I think extended fasts are fine. People do them seasonally for different purposes and just, to really tap into autophagy. But I do get concerned where people try to use fasting to negate, if that makes sense, what they
Oh,
just
yeah.
ate.
Yeah, I
That
did a lot of that.
Yeah, I think it's but do you know what I mean? Like, I think it can be a difficult pattern to fall into, because what we really want to do is figure out how to improve our food choices. You know what I mean? A day in and day out over the long haul, rather than saying, well, I'll eat whatever I want because just after that, I'll fast for 3 days. I think the sustainability and you really learning about what foods affect you, what foods benefit you, will be better if you can try to, make address different aspects. And Rome wasn't built in a day, so you're not going to do everything at once. But some people, it's easier to focus on the fasting first, and then gradually over time they're like, okay, I want to reduce this out of my diet, or this week my goal is to cut down on drinking pop, and then next week, and they do that. Other people have already made the change with their diet, or feel more comfortable making the change with their diet first, and then they will start with saying, what, I'm going to fast from 8 p.m. to 8 a.m., a nice gut rest on, and then they decide to either lengthen that either side of the window. So there's a lot of ways that you can incorporate the two and find what really works for you.
Okay. And so is there anyone who shouldn't fast?
So pretty much almost everyone can fast, but there are some where I say definitely make sure that you are talking with your healthcare provider first. So in general, pregnancy, right, is going to be one of those times where we're not recommending an intermittent fasting protocol. With that said, though, pregnancy is not an excuse to eat around the clock. And I know everyone's like, you're eating for two, but like when you're in early pregnancy, I mean that you're not eating for two. So I think a better way to think about it, for instance, I don't talk calories too much, but like our American Congress of Obstetrics and Gynecology, when you think about it, you only need for not twins, so we're talking about one baby at a time, like an extra 250 to 300 calories a day. So I mean, when you think about that,
That's just
what,
3 Oreos.
I mean, with the well, don't do the Oreos, but do you know what I mean? That's not like when sometimes people will sit down with two plates because they're eating for two. I mean, I think that that's important to keep in mind. And then you can still stop eating at 8 p.m. So you, again, don't need to eat late into the night and all of that. So, and give you an example. So if someone during pregnancy tells us they have heartburn, really bad indigestion or something like that, the first thing we ask them, how close to bed did you eat? And if they're like, oh, well, I ate and went right to bed and everything came right back up, the first thing we tell them, try not to eat 2 to 3 hours before bed and then eat in the morning. So that's an overnight fast. Do you know what I mean? So you can still, I no, I don't want people saying, I'm doing 24-hour fast while I'm pregnant or things like that. But I think not eating from 8 p.m. to 8 a.m. is very doable. That's just standard gut rest, which is what we used to do all the time. So diabetics, they can fast, but they need to make sure they're involving their care provider, particularly if they're on insulin, right? Because as you're eating, and I tell diabetics they should do this too, when they're going low carb or keto or carnivore, a lot of the insulin dosing is based on how you react to food, but for a lot of people, what is really going to spike those numbers up and have us determine like medication dosing are going to be the carbohydrate component of your meals, right? So you could have somebody who's taking X amount of insulin for breakfast, lunch, and dinner. All of a sudden, they go keto or carnivore and they realize, wait, I only need half the insulin at the meal. You know what I And so then at that point, is your blood sugar dropping too low or whatnot? So it's not that you can't fast while diabetic, but particularly if you are on insulin, you need to be forthcoming about your plans for changing your diet because those old insulin level doses will probably need to be adjusted so that you don't go hypoglycemic. Off the top of my head, those are really the biggest ones to be concerned about. We do talk about if you had a history of eating disorders, and I think it just depends on what the eating disorder was. Again, that's why I go back before, though. I think you have to look at this as a whole relationship with food. And so, I don't like when people automatically are like, well, I ate something bad, so because of that, does that make sense? I'm going to go on this long fast. I think that can be a slippery slope.
Right. So you don't want fasting to be like punitive.
Correct. It shouldn't be punitive. You should be doing it because it is a general health benefit. It's like exercise too. It's like if people are like, oh, I hate my workout. I'm like, well, you're not supposed to be punishing yourself, right? When you work out, you're supposed to be doing it because you enjoy the feeling that it gives to you. So when we're pursuing health and wellness, yes, it can be tough to make the transition. I'm not saying that, but if you're using a wellness technique to punish yourself, you have to reevaluate what your relationship is with that technique.
Okay. So this might be kind of a stupid question, but what is fasting? Because when you were talking about the pregnant women, like going from 8 p.m. to 8 a.m. is not a fast. Like that's just good, good health practices. So when do you go from eating to fasting? And I hear the word fast a lot, associated with juicing, with protein sparing modified fast, fat fast, and egg fast, and beef fast. So what is a fast?
So I think you're right. I think people today have put everything and then they just label it and then put fast after it. If we just go with the pure definition, right? It's going to be the absence of food. Now we have modified that to still say you can drink like water during it would be preferable. There are some protocols that will let you have, black coffee. But I mean, really, you shouldn't. If you're doing a pure fast, right? You're not having caloric intake. Now, when I talk about for some people, though, I will back up and say, for some people, 12 hours of gut rest is all that they need. And I mean, that technically can be considered an overnight fast. But I think when I look at 12 hours, I feel like that's just what we should try to do more often than not. Do you know, like when the sun goes down, we really shouldn't eat until all hours of the night. But for me, when you start getting into like purposely going without food for at least 16 hours, that's what I consider the fast. Now, yes, you're right. There's juice fast. There's protein sparing modified fast. There are fat fast. There's egg fast. And so what people are doing when they do a take on some of those different types of fast are they're trying to tap into really the different ways that we can modulate like with our diet. So go back to keto. Keto is a fast mimicking diet. And so that's why some people who are in deep ketosis don't necessarily need to do extended fast or not because they're getting that autophagy benefit by having low levels of insulin at a baseline. And so then the fasting acts synergistically to it. So for some people whom find difficulties with fasting, they're like, well, but I could, do an egg fast. And so basically what they're doing by that is reducing their insulin levels, kind of mimicking fasting because with the fat and the protein content there, right, they're not really stimulating insulin. So there are a lot of ways to do it. I personally prefer just a traditional fast. What I have found with people is when they start to try to figure out, well, what can I have that won't technically, break my fast or that will technically give me the benefits, I find that then they end up not fasting. So, I mean,
if you look for too many loopholes, it's likely
right.
you don't really want to fast.
Correct. And then you're like, because I mean, even with myself, I've done this before. I'm like, oh, I'm fasting, but man, my husband just made bacon and I really want a piece of bacon. I'm like, okay, well, if I eat bacon, right, that's not gonna spike my insulin that much. So I'll eat the piece of bacon and then I'll go back, to fasting. It's fine. And then I eat the piece of bacon and then a few hours later, I'm like, oh, is there still more bacon left? And then at that point, I'm like, all right, let's restart this. Let's just sit down, have the meal that you want to have, reset the clock, and let's go. So that is the thing when I think, because there's another popular protocol where people are like, well, as long as you keep it to less than 200 calories a day, you haven't broken your fast. And again, I think once you start kind of that nibbling, it's really easy to go over. And so I would rather people focus on their food quality while they're eating so that you're satiated enough so that while you're fasting, whatever time you've decided you're fasting, that you can fast and do mainly water, preferentially. But if not, and you really do like coffee, do your black coffee there.
So Do you get the same benefits from doing a water fast while trying all of those other fasts, or are they not as powerful as a water fast?
I think the water fast is still going to be the most powerful. Again, all of the different methods will have some benefit because when you look at it, many of us are so metabolically unhealthy. Do you know what I mean? Like just getting rid of some of those additives and whatnot will help. But I do think with a pure water fast, you're able to really tap into autophagy more. You know what I mean? You're able to get that maximum cycle, cell rejuvenation. So, and that's not to say every time I fast, it's a pure water fast. I don't want to give that impression that I always do, water and etc. But I try more often than not. So if we're looking at a 7-day week, Mondays, usually I'm like, okay, it's Monday, so I want my coffee. You know what I mean? Like just getting back into the swing of things. But usually by the time Tuesday, Wednesday hit, I'm trying to do more of water until I decide that I'm going to break my fast and eat. I tend not to bring lunch to work. So if I don't bring lunch, I'm not going to eat lunch. And then if I notice that I am getting hungry or whatnot, a lot of times it's either dehydration or electrolytes. And try to correct those, and then I'll also get up and go outside for a walk or things like that. So I personally find that's what works for me. It works really well with people that I work with, but also understanding that every fast is not going to be the textbook fast. And so when you're first starting out, you may use bone broth. When I first started out and I did my extended fast, I used bone broth until I got tired of it. And I was like, okay, I'm just going to drink water now. There can be a lot of different ways. And I think the key is that you are still getting some benefit, especially if you're willing to work on your nutrition.
Okay. All right. That helps a lot. So how does one get started? And should one jump into, well, since we're the Black Carnivore community, we're talking to carnivores, should
Yep.
you jump into a carnivore diet and fasting at the same time?
Honestly, I would probably say if you have not done carnivore, you know what I mean, at all. So we're not talking about, well established carnivores. I would probably say pick one or the other to start with, because I do think that is just going to be a lot at one time, because we all have heard about the keto flu, right? And many of us may have experienced that when we start to cut sugar from our diet. Yes, eventually you feel amazing, but those first 2 to 3 days, do you know what I mean, can be a bit rough. And so what we want to do is set people up for success, right? So if you're trying to do too much and you're like, oh, I don't feel great, even if people are telling you like, just give it a few more days, like your body will adjust. Um, a lot of people fall off the bandwagon, not even in the first week of trying something. Do you know what I mean? I mean, think about the holiday gym membership sign up. Packed January 2nd, right? And by February, gyms half full, right? So again, we want to set people up with success. So I would say if you are wanting to try carnivore and you really want to try carnivore, then focus on carnivore first, but put in that 8 p.m. to 8 a.m., right? Because there's still benefit there. We get caught up hearing about all these people who have done like 24-hour fasts and 72-hour fasts. And so then we think our 12 hours, isn't beneficial, but it is. So I would say, focus on the carnivore first, but try not to eat from 8 p.m. to 8 a.m. And then as you're getting more familiar with carnivore, you can extend that, to 16 hours. Or if you're a frequent stacker, you may end up, your goal might be 8 p.m. to 8 a.m., but then making sure in between meals, you're going 4 to 5 hours, during the day. So there's a lot of ways to play with that. Conversely, if you want to start with intermittent fasting while you gradually lower your carb intake, that's also, an option. But like I said, you don't necessarily need to start with all of it at once. I would say give yourself a couple weeks to adjust. Do you know what I mean? And get
Mm-hmm.
things down, and then start adding in other things.
Mm-hmm. And what would you say that there are particular benefits of fasting for Black people in particular, and what about Black women? I mean, we have a lot of metabolic disease. There are more difficult pregnancies, more high risk pregnancies. So where does fasting fit in for us?
We should fast. I mean, honestly, we really should fast. And I think, especially for us, the benefits of fasting are huge, particularly because we know. I mean, people try to talk about it and sugarcoat it different ways, but we have the data, right? When Black people go to the hospital, and it's not every hospital, but if we're comparing national averages, right? Our care, our outcomes tend to not be that of our counterparts of other racial ethnic groups, right? With higher rates of maternal mortality, with higher rates of stillbirth, with COVID and the pandemic, our death rate is higher. So I mean, they're just different things that if we can decrease our reliance on the healthcare system, you know what I mean, and try to reverse and prevent some of the diseases that cause us to present, right? So insulin resistant is going to be linked to heart attack, right? Stroke, that we have poor outcomes in those aspects. With cancer, often our cancer is diagnosed at later stages compared to other counterparts. Many cancers have insulin resistance as a component of that. So in general, if we can reduce our insulin levels, and there's more that goes into it, but insulin is probably one of the bigger targets, and decrease that inflammation and improve our overall health, what we're really doing is decreasing our reliance on the healthcare system.
Well, I totally support that. That's
Yeah.
great. And what about fasting for women, generally? Are there any differences for fasting for women versus men? What do you see in your clinical work?
So in my clinical work, I have really not seen a difference to approach women differently than men. Now, I have definitely read and I've seen online where different people, say, depending on the time of the month, if your period's there, you should fast this length, or you shouldn't, or that women should do this for this body type. But I will tell you, when you are have a patient in front of you who is 300 or 400 pounds, just getting started on fasting, we're going to see people lose weight. And so, what I really try to look at is, again, we look at nutrition, we look at fasting, and then I also like to incorporate resistance training. I think people think, resistance training, they automatically think I'm talking about, lifting 300-pound weights or things like that. We forget those squats, wall push ups, leg lifts, crunches. All of these things are a form of resistance training, even using your body weight. So we try to incorporate a myriad of that, and not all at once. We pick whatever the patient thinks they can realistically do. We get some small wins going, and then we build upon that. But I guess that is a long way answer to say I personally don't treat women differently than men and look at someone just because of their gender. That means this is the protocol you should be on. I really try to look at their life, what their activities are, and how can we set a fasting schedule that is most likely for them to actually succeed and continue to do it long term.
Mm-hmm. And do you see an impact of fasting on hormones? Like, do women with dysregulated hormones see improvement?
So with how I gauge is more, I go clinically in terms of routinely drawing. Well, I shouldn't say that. I draw some labs like thyroid, and we check that, especially if they're having difficulty with their periods. So I do check a set of baseline labs, but I honestly let their body tell me how they're responding. And so, particularly with my PCOS patients, if someone comes to me and they have irregular cycles, I think a few people in particular, they, always had irregular cycles. And then after 6 or 7 months of working together, I get a call to my office. I just got my period and I didn't have to take birth control to do it. Do you know what I mean? So I start looking more clinically because my thought process is a lot of people don't think of it this way, but the menstrual cycle is another vital sign. So our body wants to reproduce in a healthy state, right? I mean, just intuitively, the healthier you are prior to conceiving, the lower your risk would be for pregnancy complications. And so when we start to see the menstrual cycle become more frequent and regulate out, to me, that is a sign that what is happening, what we're doing is working.
Okay. And how about for perimenopausal or menopausal women? How is fasting beneficial for that group?
So I will say, because I'm a high risk OB, I would say over 90 to 95% of people that I work with aren't perimenopausal, because they're coming to me because they're either pregnant or wanting to get pregnant or just past pregnancy. So
Mm-hmm.
I have not worked with as many probably perimenopausal women as what other people have. And that's just because of what my focus is. Just from friends and different colleagues who I know that are perimenopausal who have started intermittent fasting, they tend to seem to do really well with it. What I've heard, in this, again, this is a small N, so I don't know that this is true across the board. Sometimes the extended fasting is a little more difficult. And so what I've at least told my friends that I've worked with is that, again, focus on the 16 to 24-hour time frame window, but how about we make sure to also pay attention to our diet as well.
Mm-hmm. Well,
And then,
speaking of that, oh, go ahead.
oh, and I was going to say too, the thing too, again, I mean, not to belabor the point of the resistance training, but, as we age, we do lose muscle. Protein intake, I know people have scared people away from eating quality protein, but we really have higher protein turnover and muscle breakdown. So as we age and approach menopause and are in menopause, I mean, we really have to keep up with that protein intake, and also making sure that you're getting adequate sources of vitamin D, which you can do obviously through a carnivore diet, but also by sunlight, and making sure that we are doing resistance training. And again, it doesn't have to be lifting heavy, but we really need to make sure to preserve muscle as we age.
Yeah, I had read that our need for protein actually increases as we get older.
Correct. It
Okay.
does. And so people, are sometimes cutting protein out and not doing resistance training at the time where they probably need it, some of it the most, just to maintain what they have. Do you know what I mean? And not lose. So,
Right. Well,
mhm.
that is a question that people bring up a lot, is muscle loss. But, let's just dive right into, what are some of the problems that, you know, people experience with fasting, and how do you troubleshoot that? And, I guess this fear of fat or of muscle loss is one of those things.
Right. So I think, again, it depends on how you're fasting, right? But in terms of when you're fasting, so yeah, you'll see, and honestly, that's going to be more where we start to see more cell and protein turnover. Those are going to be with more of your extended fast. So I think we also have to get people away from the fear that you can't go 16 hours without eating and you'll waste away, because you won't. Like, that's not going to happen. Also, when you do your extended fast, there are mechanisms at play. So even though you'll have protein turnover, you really shouldn't come out of it with just having a ton of decreased muscle mass. Remember, our bodies were adapted to fast because there were period of times, especially during the winter months, where people may go a couple days right without eating as they're hunting and gathering, right? So the issue that I see people run into is when you're trying to do extended fasts too often, because again, you're supposed to be using it as a tool, right, as part of a healthy lifestyle. And so you need to make sure you're keeping up on your nutritional needs. But again, a 16, 18 hour, a 24-hour fast, that's not what we're talking about. Sometimes I've seen people do 7 day fast and they're like, I'm going to do a 7 day fast every 2 weeks. I'm like, well, that's probably a little too intense, right? I mean, that trust me, our the ancestors were not purposely not eating every other week for 7 days. Do you know what I mean? Like circumstances
Mm-hmm.
may happen where but they weren't doing that purposely. So, in terms of people who like extended fast, and I even do this for myself. I usually do like a seasonal fast and reset once a season, get that autophagy benefit. But I don't try to do that, day in and day out every week. I tend to focus on doing anywhere from 16 to 20 hours. It really just depends. Like today, it's probably going to be 22 hours before I actually, have my meal. And if it's too late, by the time I want to eat, do you know what I mean? Then these are the days when I'm my busy days where, yes, it can turn into a 36-hour fast because I'm not going to go home and eat at 10 p.m. at night. At that point, I'm just going to wait until the next day. So I definitely have times where it goes longer. But that's just me kind of listening to my body, looking at my calendar, you know what I mean, and seeing what's
Mm-hmm.
going on rather than me saying, okay, you know, I'm going to fast every week, 5 days straight, Monday through Friday. I think that's when you can start to put too much stress on your body.
Well, what are some fasting protocols? I mean, I've heard you talk about 16 hours and 18 hours. What are some of the common ones, and when would you use them?
So we've already talked about 16 and 18 hours. Another one that I do like 1 meal a day. I tend to caution people about 1 meal a day, like every day. Do you know what I mean? 365. But I say that, and I do know people. So um, it's I hope I don't get her handle wrong. It's 1 meal a day. OMAD Mama Love, I think is her handle, but she's on Instagram, and she it routinely does 1 meal a day, and I think she's done it for years, and she thrives on it. So she's found out what works for her. But when I look at her Instagram, the thing that I notice about her is that those 1 meals that she has, those are quality meals. I mean, she's eating a good meal. The thing that I find with some people when they chronically do 1 meal a day is that they're not having high food quality. Do you know what I mean? And so they're not getting in the nutrients that they need. Um, what I find is another popular protocol for people is to do 1 meal a day 3 times a week. And then the other 4 days a week, they do like a 16-hour. And I think that's a very nice protocol to mix things up and get things going. Give yourself a little bit of a challenge. But then on your off days, you're still doing a baseline fasting. And what I find is that if people can do 1 meal a day, those few times a week, when they do their 16 hours, they don't think anything of it. And that's one that I will use with people a lot if they're getting started.
So, does 16 or 18 hours really count as a fast? Because I imagine in when you have a 6 or 8 hour window, you can still get a full day's worth of calories and nutrients in that time. I mean, so you're not exactly missing out on however many calories or nutrients you might have gotten in a day. Do you know what I'm saying?
Right, but I still consider it as a fast because some of it is just related to meal timing and how often are you spiking insulin. So when you do the 18-hour fast and you're confining your eating window to 6 hours, I mean, hopefully, and everyone does things differently, but hopefully what I usually encourage people to do is in that 6 hours, have two discrete meals. Don't then graze all that 6 hours. And then what you're
Well, that
seeing
was
is
going to
that
be my next question. So, can I eat for 6 hours straight and it's fine?
no, I would say don't do that. Try to still have a discrete meal in between time. So that still may be you eat 3 hours and 3 hours again. You know what I mean? You space and eat, but you still want to have a discrete meal so that you're not just like grazing during the time. And then hopefully those meals are satiating, right? And are of quality so that you're not just kind of undoing what you did. And by doing that and having meals during your eating window that don't spike insulin much, this is how it becomes a synergy. This is how it's synergistic.
Okay. Well, so to talk about some of the other challenges that people have with fasting, I'm just going to run through a few things. So, one, hunger. How do we deal with hunger?
The more often that you fast, that helps. But this is the other thing too. So hunger can be for a lot of different reasons, right? You could be bored, you could be upset, you could just want to eat something and you're not truly hungry. But I will also say something that is unique to carnivore is that, again, if you are truly following a carnivore protocol, at baseline, you probably aren't spiking insulin a lot, right? I mean, that's why we're noticing such great benefits with carnivore. And so, what I think the misconception is that people feel like if I don't fast longer than 12 to 14 hours, it doesn't count. And that's not true because, again, that carnivore diet is going to pair really well with fasting. And so, I have met carnivores who are like, it doesn't matter what I try. I can't go past 16 hours. How can you help me get past 16 hours? And then I always flip the question back on them. I'm like, well, are you feeling better? Yeah. Are you on less medication or no medication now? They're like, yeah. I said, you're getting the results that you want? Yeah. Okay, then why do you need to fast more than 16 hours?
Mm-hmm.
Oh, well, because such and such. I said, but why do you need to fast more than 16 hours if you are making progress and happy with your results? Do you know what I mean? And so at that point, we kind of rethink it. So there are definitely ways to troubleshoot hunger. But I would also say if you are, again, progressing well and you find that your max is whatever, 18 hours, that's fine, and then just incorporate that schedule into your life, and that's okay.
Well, a lot of times we don't have realistic expectations about how we should be progressing. So some people may be progressing well, but still feel like it's not fast enough, and more fasting would make it go faster. So is that true? What do you say
No,
to that?
well, that's true too, and we have to have realistic expectations too. So I know we see people on the magazines and they're like, I lost 200 pounds in 6 months, or like whatever it is.
Mm-hmm.
I don't think that gives you a lot of time to figure out what works for you. So like when I lost 50 pounds, I mean, that was a span, I want to say it was like over 18 months. So certainly that's not the impressive headline. Do you know what I mean? Because that would, losing 50 pounds in 6 months. And I know people who have lost 50 pounds in 6 months. For me, that just wasn't, that's not how quickly I lost it. But it gave me time to also figure out what worked, try different things. And then the other thing people have to realize is we're always talking about the scale and we're throwing out a lot of numbers, but like you can take two different people at the same weight and they have completely different body composition. So, I mean, that is also something to keep track of your measurements. Your scale may not be dropping as fast as what you'd like it to, but is your waist circumference decreasing? That's a better marker. You can do like in-body measurements, or people are getting DEXA scans. Are you seeing that your visceral, which is your abdominal fat around your organs, is that decreasing? Is your bone density increasing? Do you know what I mean? Is your muscle mass increasing? So I think we have to get away from like the scale and think about what are other metrics, and then what can you do consistently. And sometimes it is, you do need to change your fasting protocol and things like that. So I'm not saying that you can't troubleshoot, but again, I think we have to look at realistic expectations and what else beyond the scale um, is important.
And this is a question of mine that I ponder, and there may not be answers, but why do we get hungry? I mean, if we are fat adapted, our body is easily able to pull from our fat stores. So when we're fasting and we don't, and we're getting energy from our fat stores, why do we get hungry?
So there can be the hunger complex, and signaling protocol is so detailed and whatnot. There are a lot of reasons why people perceive hunger. And right, you're right that we think, and we classically preach in the dogma states that if you're fat adapted, that's one of the benefits of being fat adapted, that you're not, that you shouldn't get hungry. But again, I do remind people, especially if you've troubleshooted and things like that, I mean, we also are supposed to eat. So eventually, what hopefully should happen as our hormones balance out, as we've improved our gut health, I mean, all of those can affect when we're hungry or not. Hopefully, then what should happen is that we're getting hungry because we're actually hungry, and we should eat. So take a child, right? If you don't, take a child in the summertime, they may go outside and play all day, like all day, with their friends, and they don't come inside once and ask for food. They don't, you know what I mean? They don't do anything. Then, because they weren't hungry, they were fine, they were occupied, they were playing. But you could take that same child on a different day, and they may seem like, oh my gosh, they've eaten 3 times already, and then they go without. But that's because I think kids, before we start introducing junk to them and start telling them it's time to eat and eat, they are an example of just following their natural hunger cues. So I think we have kind of placed being hungry in a negative connotation, because we do need hunger cues because we are supposed to eat. The issue becomes is are we eating and we have mixed true hunger cues with emotions, or do you know what I mean, or other things like that.
Gotcha. Okay. So, on conversely, how do you deal with binging after the fast? Or do people do that? Am I the only one?
No, no, no. People definitely do binge after the fast, and so I think you have to look at, is there a certain length of time? So say if you fast for 16 hours, do you find that you binge after that, or is it only after you try to fast for 36 hours? Do you know what I mean? And so obviously, when you break your fast, you want to be conscious of it. What I tell people to do if they are suffering from binging after the fast, obviously, you don't want to think about what you're going to eat. It's like a double-edged sword, right? Like, you don't want to be planning your meal all while you're fasting, because then you're fixated on food. But like, you could just, in a time where you're not fasting, kind of just plan out, you know what? Okay, I'm thinking of doing a longer fast coming up in a few days. This is how I'm going to break my fast. This is how I'm going to break my meal, and kind of plan ahead of time and see if that helps. But if you feel like after your fast that you are just sitting there ravenous and gouging yourself, you may have pushed yourself too hard. Because I think when I usually fast, like I said, even though by the time I break my meal, it may be at 36 hours. if I'm solely not eating tonight just because it's too late and I get up and eat breakfast the first thing in the morning, my breakfast is pretty usually the same thing. Like when I do eat breakfast, my breakfast is either going to be like scrambled eggs. I do mix in a little onion and pepper with it, but scrambled eggs, and then if I'm truly making an omelet, I might do, mushrooms with that. And then I usually have a couple sausage patties. So it's nothing elaborate. It's nothing, you know what I mean? But that's my go-to breakfast. And so what I would do in the morning is that since I already know what my go-to breakfast is, I'm not going to sit there and cook 5 omelets. You know what I mean? Like I'm going to sit there and make my 2 egg omelet, get my mushrooms and fix my sausage, and then I'm out the door. So I think just knowing kind of what your go-to meal is post fast, I think also helps prevent you from just looking around, right? Because that's the thing. When you're not planning, you're looking around and grabbing everything that's near you, right? And again, that's when people get into trouble.
Yeah, that makes a lot of sense. So now I want to move on to something, I guess, that's sort of indelicate. And, what do you do, or how do you advise people who have diarrhea after a longer fast? I mean, that doesn't seem to usually happen with 16-8 or 18, but,
Right.
when people start going 36 and, on up, then that starts to happen. So what do you do, or what do you say?
So I've found, especially I know like as I've experimented with different fasting protocols, the times that I really have diarrhea after my fast is when I do a longer fast and I break my fast with too high of a fat meal. And it's not that we're afraid of fat or anything like that, but I notice that can literally run through you. So when especially looking at different options, if you are carnivore, it can be tricky depending on what the fat content of that meal is. So not that we want people to routinely, if they're doing carnivore, excuse me, um, go for all lean meats, right? Because you're not going to be getting a good variety. And we do want those fats in. But particularly after you've done an extended fast, I would reach for leaner cuts of meat. So whether that's going to be poultry, do you know what I mean? Or getting a leaner cut of beef. I would start with a small meal of that. And then, so if we want to say it's chicken, I'd start with a small meal of chicken. And then I would give myself a good 3 or 4 hours. And then you can reach to a slightly fattier cut of meat, but still not something, too fatty. And then that way you're giving your gut several hours to adjust. And then what I would do, whether it's later that day or the next day, then you can go back to like whatever you would typically eat in your routine. But I do find that, uh, you know, high fat content tends to run through people literally more than when they're able to stick with like a leaner cut of meat.
So that would mean that a longer fast would be, you have to do a little juggling to figure out how to do, like, let's say you wanted to do 2 42-hour fasts in a week. It would be, you'd have to do a little juggling to figure out how to have multiple meals after the 42s. You see what I'm saying?
Correct. Or, I mean, but if you're coming off, so I know how I talked about you don't want to graze consistently, after your fast, but that's more for like your 16, 18 hours. So if you're doing a 42-hour fast, if you need to, over a 6-hour period, break it up in smaller meals, do you know what I mean? To like get your body to adjust rather than having this huge meal that literally just runs out the other end, that's okay. So
Okay.
I think you have to do that. That's what I mean. Like if you're doing an extended fast, you really have to be more purposeful on how you break that if you're trying to avoid the GI distress. with 16 or 18-hour fast, the reason I'm saying not to just graze all those 6 hours is because your last meal was just 16 hours ago. Do you know what I mean? So, like, in theory, hopefully, you can eat a good meal and wait a few hours and eat your next meal and then start the process all over again. But with extended fast, you do have to give yourself time to, kind of recover. And there's some people who 42 hours don't phase them at all with any GI issues. And it's not until they get into 72-hour plus fast. Everyone's uh, gut is a little different. But once you've experienced kind of that post GI distress, you know what it is. And so at that point, you're trying to troubleshoot for yourself. But you definitely could have smaller and give your gut time to wake up.
Okay, that makes sense. And then what about, well, are there any other types of GI disruptions that people have? I mean, diarrhea is one, but anything else that tends to happen with fasting?
Um, Even if they don't have diarrhea, sometimes people feel bloated, gassy. I've seen people even like have vomiting after an extended fast because they ate too fast, too quickly, and their gut wasn't awake. So there can definitely be issues, and so that's why I'm like, and I do extended seasonal fast myself 4 times a year, but my routine day in and day out are going to be shorter fasts focusing on my food quality because then I don't run into you know, those GI issues.
Okay, gotcha. And then another thing, do you find people have like unstable blood glucose or it, goes too low? Like, does that happen or do you see that?
So here's the
And
thing.
how does the dawn effect play in with this at all?
Right. So, I mean, when people are, and that's why I said that's why you want to do these things gradually because, I, it's so say if someone's diabetic and they're used to living at blood sugars in the 250s, right? And all of a sudden they're now running in the 100s and it happens quickly to them. They may feel like, oh my gosh, I'm hypoglycemic and low blood sugar, where actually we would still look at that and say you're not too low, if that makes sense. So some
Hmm.
of it is just giving your body time to adjust. As you adjust, I mean, there are people who walk around in the 60s and 70s and feel completely fine because they are now fat adapted. Do you know what I mean? So I think the feeling of going too low is relative depending on what your metabolic health was to start. Now, again, the exception to that rule is if you're a diabetic on insulin and you take your full dose of insulin, but you haven't accounted for the fact that you no longer need that much. That's a whole different story. And yes, that can drop you dangerously low very quickly, which is why if you're on insulin in particularly, you really need to have your insulin dosing adjusted based on what your diet, because your diet matters.
Hmm. Okay. And then what about sleep? I know that when I fast more than 24 hours, like the first night's okay, but the next night I'm just going to sleep like 4 hours and just be totally awake.
Yes, that happens to a lot of people. And some things to combat that, you can try magnesium. So some people will make like magnesium oil. Some people will soak in Epsom salt. People, I don't think necessarily realize there's a lot of magnesium in Epsom salt. And so you can just do like an Epsom salt foot soak before you go to bed, which in general, if the water is warm, that should hopefully be,
Hmm.
relaxing. Those are kind of a few tips and tricks. I'm not quite sure yet how I feel about melatonin supplements. Sometimes there's mixed data. Sometimes they seem like they're helpful. Sometimes they aren't. So I tend to stick with more of the, magnesium or trying to wind down, decreasing screen time before you go to bed, doing things that can kind of like suppress or at least relax your catecholamines, those warm foot salts, soap salts, take a bath, a nice warm bath and put Epsom salt in it, let your skin absorb that magnesium. But sleep is sometimes unfortunately an issue. And, we don't want people sleeping without sleep for days, right? Because lack of sleep in general then can also create insulin resistance and things like that. So it definitely is a fine balance, but those are some things people can do to troubleshoot.
And does that tend to resolve over time? I mean, is that just a matter of experience and
Yeah,
consistency?
I will say similarly to you, kind of the first 24 hours, I don't have any issues sleeping. Sometimes between 24 to 48, I will. But then after 48 hours, at least for me, I usually am able to get back into a decent sleep pattern. And if I can't sleep, I do like sleep. So I mean, if I'm having trouble sleeping and I'm 3 days in, at that point I'm kind of like, well, do I need to rethink how long do I want to go? You know what I mean? At this point, is my lack of sleep still worth me continuing? And I do think people have to look at that. But I usually, if I can get over 48 hours, then I'm back to sleeping pretty near my baseline.
Okay. All right. Well, so I want to run through some of the questions that people put up on in my Facebook group. So let's see. The first one: how does long-term OMAD as a carnivore impact women's hormones, especially women who are premenopausal?
So, in terms of the premenopausal and that menopausal phase, I will be honest, I don't have a lot of data on saying specifically how carnivore, do you know what I mean? And 1 meal a day would impact that. So, what I tell people, well, if you're premenopausal, right, your menstrual cycle is going to be your best vital sign. So, if your menstrual cycles are regular and you're feeling good, even if it has caused minor hormone shifts, they're not enough to disrupt your reproductive function. And so, from my standpoint, I personally wouldn't even check labs. Sometimes I think people check labs for the sake of checking labs, but like if your HPA, access, that's what basically is talking, from your brain to like your organs and your ovaries on like when to ovulate and things like that. If that is intact and working well on your carnivore protocol, I don't necessarily feel the need to check labs if your cycle is regular. Again, 1 meal a day, I just caution people, you really have to make sure that you're in a nutritious meal. What I've seen with people with long-term 1 meal a day, whether they're carnivore or not, is sometimes the tendency to undereat. Even though you think you're eating a lot, sometimes there's only so much that you can eat in one sitting. And so over time, it almost ends up being like chronic caloric restriction, which we know that can play an effect on hormones. So, and again, 1 meal a day, OMAD, Mama Love. I mean, she has been doing 1 meal a day, I think, for like 3+ years and is thriving. So it doesn't mean that you can't do it, but I think those are things you have to pay attention to and be
Mm-hmm.
cognizant.
Okay. And then I think you've answered this pretty much through this conversation, but how long do you recommend someone that's just starting out fasting to fast for? So,
If you've chosen to do carnivore first, then I would start with just the 8 p.m. to 8 a.m. and then I would increase over time.
hmm and any case studies of clients fasting, enhancing autophagy, putting cancers into remission? And if so, what are some of those cancers?
Yeah, so there are a few studies, and what I can do is I can send you the link after this chat, just in case people want to look at any of them. But there has been research on fasting and more specifically with ketogenic protocols in terms of prolonging survival of like glioblastoma. It's a really aggressive brain cancer that has pretty much, I mean, typically people think of it as incurable. They have people who have been living with it for years by following a ketogenic protocol, keeping those insulin levels low. In theory, there also should be benefit for many types of colon cancer. That is one that has an association with obesity. So pretty much, and again, this is may not be the total rule of thumb, but I like to think it as it in as cancers that have a link with insulin resistance or obesity are going to be the ones that are more responsive to keto carnivore and intermittent fasting. There's also been research showing people who do a fast anywhere from like 36 to 48 hours before chemotherapy actually have fewer side effects of chemotherapy. It serves as chemo protection for the healthy cells. So the research is really fascinating. I think we're just starting to touch the surface.
Yeah, I read some of those studies by Walter Longo that about the cancer and how effective it was for fasting before getting your chemo, and I thought that was just fascinating. So yeah, so
So I
yeah,
think
please definitely send me those links.
yeah, it's definitely. So you can post in the Facebook group, and I just think we're starting to kind of touch the surface on what is there. But yeah, I mean, again, paying attention to our diet and nutrition. It won't prevent 100% of cancers, but we definitely know that lifestyle does play a role in a lot of these diseases that we're seeing today.
Yeah. Okay, so the next question you have partially answered. So, Audra asked, does fasting ever interfere with fat metabolism or cause muscle catabolism? And then she says, I hear it's best to work out in parentheses, cardio, fasted to optimize fat metabolism. Is that true?
So it depends on what your goals are. So working out in the fasting state, that is my preferred method to work out in. Um, and that it really should not, affect muscle. Honestly, if anything, you may get a little bump or it may work synergistically in producing muscle. For people who are trying to like build more muscle mass, I think working out in the fasted state is great, but then you want to make sure afterwards that you are getting protein rich meals. And so then that way, that's going to help, that repair and that recovery and really work the best. Now, again, if you're doing 16-8 and even working out in the fasted state at 16-8 hours or even 24 hours, I'm really not worried about the muscle breakdown. And even if you're working out occasionally on an extended fast, I'm not worried about the muscle breakdown. Again, I get more concerned when people are trying to do extended fasts too often. That's what becomes the issue.
Mm-hmm.
Mm-hmm.
And I just saw an article yesterday about a new study that was showing in people who were exercising for weight loss without making any dietary interventions that cardio and weightlifting were equally as effective in terms of how much weight you actually lost, which I thought was very interesting. That goes so against what we learn.
Well, and I guess the question I would have to see, because I've not seen that study, is how long did they look at? Because people will lose weight with cardio. I mean, but the thing is how long are they keeping it off? If that makes sense. And so I have no problem with like a healthy mix. Because I still like to go outside and run. I want to be able to keep up with my boys. So, I mean, I still do cardio as well, but I do think people underutilize resistance training. And so I think in the long run, making sure that you are at least incorporating a resistance training if you can 3 times a week. I mean, that's what's going to help build that muscle mass down the road, decrease your risk of muscle wasting as you get older. Do you know what I mean? Like
Mm-hmm.
you can do too much cardio, and then end up with different issues. So you can't neglect the muscle training. I think for a short term program, yeah, I mean you can definitely lose weight, but I think for when we're talking about lifelong benefits, I would make sure to incorporate resistance training into your cardio schedule. So I don't think your workout routine should be I run 7 days a week and I never lift. Do you know what I mean? I think a healthier
Mm-hmm.
balance would be I run 3 days a week and I lift weights 3 days a week. Do you know what I mean?
Mm-hmm. Yeah. Okay. And then the final question is, what are the effects of drinking coffee while fasting?
So, coffee while fasting, it depends. First question is, um, what are you putting in your coffee? So that's the biggest thing I find, because I think a lot of questions I get are just like, can I have Splenda? Can I have this? Can I have that? Da, da, da. So, coffee, you can drink it. I do say drink it sparingly in terms of its it's a stimulant. And so if you are, as we've talked about earlier, sometimes with fasting you're so hyper focused, your catecholamines are going, you know what I mean? And so you that if you're drinking coffee too late and you're fasting and already having trouble sleeping, do you know what I mean? Like you don't want to be
Mm-hmm.
on edge. So I think if you want to have 1 cup of just black coffee, again, here's where we get into the fact that the caloric intake of truly black coffee might be like 5 calories in a cup. That's not going to make or break your fast. But if you were drinking coffee all through the day, more than so it having the risk to break your fast, you could get dehydrated. And if you're getting dehydrated, then you're losing, potentially electrolytes. And then you start doing that, and then you start getting hungry, or you get a headache, or you get, you know what I mean? And so sometimes people drink coffee at the expense of keeping up on their water intake. So, and that can make your fast more difficult. So, a cup here, fine. But if you're drinking multiple cups through the day, through your fast, you kind of got to pull that back a little bit.
So, thank you so much. I have asked you a million questions, and you have laid out fasting, I think, in a way that is super, super clear and easy for people to understand. So, I am hoping that this answers a lot of questions and gives a lot of food for thought. And that, for those of you who are watching this and, were thinking about fasting or had questions, like you can share this video. And I think this will be really helpful for, friends and family who may not be ready for carnivore. This is like a good start. And this is
Yeah.
another way to work on, metabolic health in our community. So, thank you so much. I really appreciate your coming on. This means a lot to me. And please, if people want to work with you or find out more or follow you, where can they find you? Where are you?
Yeah, thank you. So, on social media, if you're interested in intermittent fasting, I'm at the Fasting Doctor across all social media channels. My website is thefastingdoctor.com. If you're interested more in kind of high risk OB or those type of topics, as I talk about those as well, my website for that is kcperinatal.com. So it's just like the letter K, C, and then perinatal spelled out. So those are kind of the two avenues to find me, just depending on what your interest is.
All right, great. Well, thanks a lot. And I look forward to having more conversations soon. And yeah, thank you so much.
Great. Thank you. Thanks for having me. It's a pleasure as always. And the work that you're doing is so important because, again, I think we need to have more, obviously, representation. But I think our goal really needs to be to improve our own health, so that, again, we can decrease our reliance on the healthcare system. Well, thank you. I appreciate your time.